While Nigeria may be recording some success in the fight against COVID-19, lack of adherence to safety protocols may portend danger. The World Health Organization include face masks in their recommendations for slowing the spread of the virus, in addition with other preventive measures such as frequent hand washing and social distancing. The Nigeria Center for Disease Control says a strict adherence to the use of masks in public spaces, particularly where social distancing may not be practical, can help slow the spread of the virus. Adherence to the use of face masks has been declining in the last few weeks. Medical experts are worried that the country could witness a surge in COVID-19 infections if safety guidelines are continually disregarded. And joining me via Skype is emotional intelligence specialist Abiola Champ Salami. Good to have you join us, Abiola Champ. It does look like the longer we stay with this pandemic, the more people flout the safety protocols required to keep everyone healthy. What do you make of this, especially in the country where a lot of people are not using face masks anymore?
You see, there is a simple explanation for this, and it's about human behavior. And there's the health belief model, which is a theory some social scientists put together in the 50s and developed they consolidated more on it in the 80s. And it is saying that a person's belief in personal threat of an illness or disease, together with that person's belief in the effectiveness of the recommended health behavior, will determine whether the person will take this behavior or not. And now, what are we saying in simple English is that people don't necessarily think that COVID is as much of a threat. They've lived through this, so they don't think, so their perception of their susceptibility to catching this virus is low, which is why you see people have just taken, as if there's nothing happening again, as if there's no COVID again. People are not washing hands, people are not using masks, people are gathering together. People are going about things like it is just normal.
Abiola, you think that denial is a motivator here?
Denial is one of the strongest reasons. And also, when we say denial, we may not be really talking to the issues alone. When we say denial alone, we may not be really dealing with the issues. There is denial. There is the fact that a number of people did not physically, with their two eyes, did not see certain people who have died due to that. There's a lot in the news about people dying, about people contracting the disease, but perhaps because they don't have friends, family members, colleagues, associates, people that they can really see, right? And so the trust quotient and what people are seeing on the media and what the government is saying, the trust quotient is low. So the probability that people will take that to inform their actions is very low because trust quotient is low.
All right, so what about the idea that, look, setting standards is more important than enforcement? Because sometimes we've seen leaders across the world say use face masks. They set the guidelines, but not necessarily also follow them. And then people say, look, if you're not following them, why should I? So where does setting standard fall in all of this?
You see, there's a responsibility on leadership, knowing that people follow what the leaders do, not just what the leaders say. So there's a responsibility of leadership to lead by example, and I must applaud the Lagos State Governor, who is doing a great work at that. So leading by example, washing hands, using face masks, there's that. There is also the enforcement as well. So while leadership is leading by example, it's also important that the necessary departments in the society, they are also following suit. So law enforcement, for example, they are also doing the same thing. Parents are also encouraged to do the same thing, and everybody's doing the same thing. Because you see, the thing about this virus is that it spreads, and it can spread to anybody, regardless of your socioeconomic background, regardless of your age, regardless of your intellect, and every one of us, we need to protect every one of us.
All right, so let's talk about messaging. You rightly noted that people are living in denial because they haven't seen. We've heard about the numbers who are dying. We've heard about numbers who are recovering, but we haven't really seen anyone who, no pictures of maybe the isolation centers, except for maybe a few media stations like ours who have gone to the isolation centers. But people rarely do that. So let's talk about the messaging. How can we improve on that?
I think that we need to get people who have, I know there's a place of confidentiality, but at the same time, to save our society, we probably need to be flexible with that confidentiality clause. So we need to get people who have recovered, people who were in isolation centers, to share more of their stories. And perhaps not only when they recover, even when they are going through the situation, because anybody can come up and say, oh, I had COVID and then I recovered. When they're in isolation center, people seeing what they are going through, people seeing the pain. Because one of the things that makes people to take on this behavior, right, is cues to action. So something that can trigger people into action, seeing how other people are going through pain. People that look like them, people that talk like them, people that are probably in their neighborhood that we can use as part of the messaging. It is great that leadership is talking. It is great that the media is talking. It is great that we're even looking at what's happening across the globe, right, to judge the prevalence of this virus across the globe. But we need to localize it by getting locals to speak out.
Now, I know you've been listening to debates across the world, especially from the United States, where some authorities, some government officials, some medical doctors, highly placed, are saying that people should do away with their masks and that is a hoax and all of that. And then back home here, where we abide by the guidelines of the NCDC, WHO, Ministry of Health and all of that, saying that face masks should be part of our normal and everyday dressing or accessories, as the case may be. What do you make of this seeming confusion?
You see, it is important for us to know that COVID is not over. I mean, shout it aloud, make the noise go on the mountain, say it everywhere for people to know that coronavirus has not disappeared from the face of the earth yet. And because of the nature of this virus, anybody can catch the virus. It doesn't respect your race, your age, your intellect, whatever it is. And the virus only moves with movement. The virus cannot move by itself. It moves. You can only contract it by meeting with people. So it's important that we sound that aloud. No matter what any other person is saying from any other place, perhaps they have a cure, perhaps they've discovered a vaccine. We have not seen anything like that here in Nigeria. So we still need to maintain safety measures. You see, and I mean, I applaud the governor of Lagos State, His Excellency Babajide Sanwo-Olu, who said that the curve seemed to be going down in Lagos State. While Lagos State has done a great work at that, I think we should also prevent a second wave. And the way to prevent a second wave is to modify our behavior and stick to these safety guidelines recommended by the NCDC. So we should still keep washing our hands. We should still keep using face masks. We should still keep maintaining social distancing. It's not the time for Owambe yet, please, people. It's not the time to even have to be in crowded places yet, please, people. It is important for us to still stay safe.
All right. As it is right now, when it comes to the use of masks, we've seen so many colorful masks that people have made and produced out there with different shapes and all of that. In fact, it is becoming a little mini economy of its own now because people have gone into buying that. But the point there is, when it comes to having it as a lifestyle, what do you make going forward? Because like you said earlier, it seems the number of people who are adhering to this are dropping. But it looks really beautiful on a lot of people. What do you make?
Now, you see, the thing is, if fashion statements will make us stay alive, please do it. Let's do it. Let's do it some more. If fashion statement, I mean, and I think it's quite creative. You know, that while we're trying to stay safe and sane due to COVID, I mean, people came up, designed some fashionable masks that people can use, and I think that is great. But hey, whether you can make it fashionable or not, let us remember the primary thing is safety. So it would be great for anybody out there who probably doesn't have the means to acquire fashionable masks to say, oh, well, since mine is not looking great, then I will not use. Please, the primary purpose of the mask is safety. Fashion statement is secondary. So let us still maintain our primary purpose.
All right, but do you think after now that the use of masks has come to stay? Now, if you go to eateries and some of the malls, if you're not wearing the mask, you can't go in, which is a good thing for now as a way of checking the spread and adherence and all of that. But do you think this has come to stay?
Well, so far COVID is still around, we will still keep using masks. I think after COVID, we'll switch to how we used to be. And by the way, there's the also security bit. There's a security issue even with masks as well. You know, in terms of people that may suffocate. And there was something in the news some days ago about someone who suffocated because of how he placed this mask. You know, there's also people trying to hide their identity. I think all of that. So people will stop using masks as soon as COVID is over.
All right, exactly. That's really part of the concern. That's really part of the concern because some persons who have underlying respiratory issues will certainly find it really challenging. And then even at the ATM machine, I understand that if you're wearing a mask and then the system cannot recognize your face, it would not allow you to withdraw money.
Well, that's part of the safety that we're talking about. But I guess banks, you know, and other institutions who are in charge of that, you know, can use artificial intelligence and some modalities to even ensure that even if you can't capture the entire face, right, you know, you can capture some points on the face just to still get to know that the person is the same person.
Okay. All right. Thank you very much, Abiola Chamsalami, for your time on the program. We really appreciate it.
Thank you for having me.
All right. Now,